morning. Yes, well, we're here again this beautiful morning. We're early, but not as early as Breakfast Central, of course. I mean, what is 10 a.m. on News Central without Ajah? Welcome to Ajah. This is the space where we don't just read the headlines, we talk about it and rip them to shreds if we have to. And we actually don't play safe here, if you must know. We're here to shift the conversation. They call me Darshan. Yes, I was actually going to say sensational Darshan, but then you can just call me Darshan. And I'm not here alone. I'm here with the girls here on Ajah, talking about Kathleen, Lala, and Buki.
Good morning. Good morning.
Didn't I felt like I was on radio right now? Sensational Darshan.
I don't know where sensational came from. But she
does look sensational. She does.
And I love that the way she ties her hair. That's our private conversation.
Yeah, thank you.
Well, today on Ajah, we are having a bigger conversation later on in the show, and we'll take you to the corridors and the parameters of what is healthcare, and that's your welfare. That's important to us. That's important to you. It's important to us as a nation. It seems as if we keep getting those, you know, our systems keep taking some sort of hit. Before it was the doctors who planned a 21-day strike, and then we obviously got called off, and then now it's the nurses that went on a 7-day industrial action, but only got called in 4 days in. And so later on in the show, we'll be having a conversation around exhaustion, we'll be having a conversation around neglect and the healthcare sector as well, that is stretched to breaking point. Because if we don't listen now, if we don't talk about it, we might not have a system left to save. But that's coming up later on in the show. But first,
from hospital chaos to housing chaos, the drama is non-stop. Let's talk about land wahala in Lagos, the kind that could actually cost you your entire home. The state government has just blacklisted 176 housing estates, mostly across Eti-Osa, Ajah, Ibeju-Lekki. Declaring them illegal for not securing proper layout plans and planning permits. Developers and real estate practitioners have been handed a 21-day ultimatum to regularize their paperwork or risk demolition. Now, the Ministry of Physical Planning and Urban Development says these estates were built on basically, in quote, vibes and inshallah. No approved layouts, no planning permits, therefore making them illegal and punishable under the Lagos State Urban and Regional Planning Development Law 2019.
Honestly, I have to sing I love that, vibes and inshallah.
Yes.
Anyway, according to the statement released, if developers don't submit all required documentation to the Ministry of Physical Planning in Alausa within 21 days from August the 4th for proper processing, then they risk demolition. Some of the affected area estates include Adrian Homes, LS something. Oloruntoba, okay. Aino Gold Estate in Folu, Diamond Estates,
Eputu.
Prime Waterview Garden, Royal View Estate, Ikota, plus dozens more. Just look at the list anyway if you find yourself situated there. Some of us have been shouting. But while the government is pointing fingers at developers, it's the homeowners who could end up losing very, very big. Imagine losing your entire house. People who have built homes, paid millions, are now being told their estate does not officially exist. This literally what happens when a system fails. It is usually the people who pay a very, very huge price. Imagine.
Okay.
Imagine.
So when they were building the house,
when were they?
Where were they? This is what always gets me. I try and stay away from these newses. I call them newses because I actually don't know what to say. 176.
Yeah.
Jesus.
It took
Some
at
estates are
least
recognized.
some estates at least
5 years.
took about 5 years to
To
complete,
build, yeah.
right? You're saying that they don't have layout approval.
Remember
What does
when
that
we
even
had-
mean?
But you know, a conversation
Yeah.
where buildings were being demolished. That
Yes,
way on
that
canals.
time that
Yes.
there was an estate. Where was it? Because I know someone
It was
who was affected.
there were
was
houses in Maryland.
Yeah,
There were houses in Maryland, in Mende,
Yeah.
that were being demolished because they were built on canals.
Yes.
And you're like, but you can see these things, these structures
But
going up.
those are the things
you
that-
have people going around though. Once they start seeing bricks and blocks,
Yeah.
Yes, to collect
people are going
levies
around
and all
collect
sorts of
levies.
things.
So what is happening?
But it's not possible for us to actually say that some government officials are not involved in this. Or they had no idea. They were clueless as to, when the developers started, building the estates and all that. I went on social media and I saw so many people talking about how we all know this is the normal thing that you guys do. It's a way for you to actually make more money or get more money from these estates.
But I don't, no, maybe not under this dispensation, because we're on this table when that Maryland incident happened, and somebody that we know very well was even on News Central to discuss it. I think Isabella Adedeji.
Yes.
She's an events host and everybody.
Right.
But I'm finding out that aside that this demolition might take place, I'm talking about a systemic rot, because it cannot just be the homeowners that will suffer. Somebody gave some kind of go-ahead in their system, because they can't tell me that they will build up estates, 176, an entire estate in different locations around the same axis, and you want to tell me that none of them, no government intervention. Of course, somebody must have gone to collect some kind of permit. Maybe they are now not collecting the permit from the right places or tables.
Because in Nigeria, unfortunately, they'll say where there's a will, there's a way. Money talks, BS works.
Yeah.
So there must have been shortcuts that people had circumvented to get these documentation. Okay, you get this documentation, but are they the right documentation?
Yeah, that's what
they just give you that to show you that, listen,
that you have papers to continue working.
I was abroad for a while. I'm digressing a bit. Now, I went to submit a particular document, and I was told that, I needed a certificate of nationality. I said, no, we don't have it in Nigeria. They said, no, that we have it here, what are you saying? We have it. I said, no, we don't have it.
I've never heard of that before.
They went to the folder and brought it for me. My fellow Nigerians had brought out, certificate of nationality. Do you understand? So I had to now adjust. I said, well, we are different ethnic groups in Nigeria, and so maybe in some spaces, but I don't have it. So for me, I'm saying that a Nigerian will manufacture any document you say you need, they will manufacture it. So all these people who are building estates, there was a time where there was one estate in that was very popular.
Yes.
A lot of noise was made about that. So you can imagine if they succeeded in erecting structures that made up that estate, and everything they asked for, they got it by what? Someone in the office.
Because one of the estates had a crash this
Thank you.
I just don't want to mention.
So like Lolo would say, somebody is responsible. Are we ready to narrow it down?
Let's take some reactions from Nigerians.
Let's get
Everybody whose estate has been mentioned.
I did tell you, if houses collapse, now go blame government. Now the government has said they should just bring the layout and plans for checking and reapproval. They are not scrapping all the homes, just those that are not fit. Make una they try, they read. Okay.
All right, well, we have this one that says of 176 illegal estates Lagos government listed without layout approval plans, more than 150 of them are in Lekki, including some with fully built houses up to 10 years old. How do you build a house or buy a building in an estate without layout approval? There has to be consequences.
Please keep doing this. Information and communication from government ministries, agencies, and departments are essential, and I love it. Okay?
A government allowed 176 estates to spring up within it, only to wake up now and list them as illegal estates. where are the officials that approve the structures within these estates?
If you ask me.
Why is the Office of Physical Planning only now waking up to its responsibilities? You people need to be more proactive and restore trust in the system. When the chips are down, it's innocent buyers in those estates that would be on the receiving end, which is so true.
Yeah. These people must have gotten government approval before they started the operation. We should clamor for interagency cooperation rather than coming out with a damaging publication. You will be surprised to note that most have a CFO or government concern, so it's madness for a sister agency to label them as illegal because possibly their layouts weren't approved.
Mbise, thank you.
If you get house of 120 million for Lagos today, make you day homeless tomorrow. For me, I just go there. I just go there, enjoy my vacation and leave. Very terrible state to live in, but good to have fun. Is it Lagos that they are talking about?
Yes, so I was said that
for vacation. Guys, this is serious. It is true. Vibes and inshallah. Like, you really just don't know. For a few months, I've been thinking about, I want to buy land, I want to do this. I am so afraid. I'm so scared to actually, to make that investment because I don't know who is going to happen. What's going to happen? Is it going to be a land that one government will now come and say is on government property? Or is it Omoniles that will not allow you breathe? Or is it that you will be scammed? Because there's so much nonsense that's going on.
You have a very valid point.
So much nonsense.
I had to actually advise one of my friends against it because he was like, he wants to come to Lagos and, buy a house. And I'm like, you need to be absolutely sure where you're getting the land, and the papers from, because it's not as easy as buying land, in the north or even in Abuja. And, most of these people that actually have, even shops are not left out of it because there's actually an ongoing case of someone who, has had, it's been in the family, the shop has been in the family for a while, and is it the local government people, they've actually come to demolish the shop, just like that.
I just say,
we're living a life.
Are we going to follow
vibes and inshallah?
They told the, and another thing is,
I think that's the best way that it could have been put.
And I like what one of the reactions said. He said, sister agencies need to have some kind of intercooperation. Yeah. Because sometimes there are different agencies that do different things. But if there's no cohesion, how would the center hold?
There's never cohesion, and there can't be cohesion because they have to create multiple avenues for loopholes, for chopping.
I will take a look at the loopholes that some of these documents fall into.
What do you call VIO, road service, the police, the ones that wear white, the road safety ones, and they're asking for different particulars. Guys, you're talking about there should be and
the funny thing, aside all those sister agencies, now, if this is going to be sorted out, they're going to
set up a new committee
to look into it.
And it will span for some months again. Even though I know some structures that are still built on canal in VI. If they really demolish, if they're doing that.
Anyways, we will be taking a short break now, but when we return, we dive into the heart of the matter. Why did Nigerian nurses walk off the job? Why was the strike suspended just 4 days in? And what does all of this mean for the future of healthcare in this country? Our guest, Oloruntoba Odumosu, the Lagos State Secretary of the National Association of Nigerian Nurses and Midwives, joins us with answers after this break. You don't want to miss this, so do please stay with us.
So, it's no longer news. The National Association of Nigerian Nurses and Midwives has suspended its nationwide warning strike 3 days ahead of schedule. What began as a 7-day industrial action demanding urgent reforms in the welfare and working conditions of nurses was called off on Saturday, the 2nd of August, after the federal government and the union leadership reached a memorandum of understanding with concrete timelines. But beneath this headline lies a deeper crisis. So for years, Nigerian nurses have endured long shifts, inadequate staffing, poor remuneration, and dwindling morale. According to available data, over 42,000 nurses have left the country in the last 3 years, of course, seeking better opportunities abroad. Now, during the 4-day strike, public hospitals across Nigeria, especially in Lagos, Abuja, Kano, and Port Harcourt, were stretched thin. Patients turned away, emergency units overwhelmed, and routine care halted, exposing just how fragile our healthcare system really is when its backbone, the nurses, step aside. So, what did the government promise to bring the strike to an early end? What exactly is in the agreement? And more importantly, what happens next if these promises are not fulfilled? Questions, questions, questions. But Oloruntoba Odumosu is with us in the studio. He's a Lagos State Secretary of the National Association of Nigerian Nurses and Midwives. He will walk us through the union's demands, the government's commitments, and what's truly at stake for healthcare delivery in Nigeria. Mr. Odumosu, welcome to the show.
Thank you very much. It's a pleasure to be
here. You're very welcome, Mr. Odumosu. Let's start with what's on everybody's mind. The strike was meant to be 7 days, but, you know, it ended just after about 4 days. So everybody is itching to know, what did the federal government promise during the negotiations that actually convinced your union to call off the strike quite early? Or was there something urgent behind the scenes that was a strategic move by your association?
Yeah, thank you very much. It's a pleasure to be here. So I think the first thing we must understand is that when unions call for strike action, it is not we're looking at the impact on people. Why we call strike action is to get the attention of government. And when you get their attention and you begin discussion and you begin to get certain concessions, and especially in our own sector, which is essential care, so you can't, you then have to see you have to review what the situations are. So, and it's unfortunate that the strike even commenced at all, given that I will tell you that our union is a very responsible union. In the last 20 years, we have not called, more than 2 decades, we have not called out an action like this. That is not because there haven't been issues. Everybody knows about brain drain and all that. But as now, we have never had this kind of action in the last 2 decades, which shows the level of restraint that the association has and the premium we place on the strategic role within that sector. And even for this, last year, a 15 days ultimatum was also issued. There was discussions, and only one issue was taken off the table, which was the issue of the verification portal then. Yeah. Because effectively government, sort of cunningly locked people in. Because which ordinarily you expect that if you have done that, then you should have done something to improve the working condition and make people, the places where our members are going, the simple thing is that they're just better working conditions. Yeah. But we understand there are pull factors, but you then, at least within your own capacity, what you is expected that you need to address the push factors. There are strong pull factors because of economic differentials and things like that. But also, if the remuneration has remained stagnant and poor, if the working conditions have remained very, very terrible, and those who are staying behind, who ordinarily probably do not even want to travel, are now saying that, okay, if we were 10 working on this world before, and then 5 have gone, and the government has not replaced it, what it means is that 5 people now have to do the work of 10
people.
Those who are staying behind are at huge disadvantage. So with that kind of situation, you wouldn't expect. So, but back to our industrial action, the leadership. It was also unfortunate that within that 15 days ultimatum, the federal government never engaged with the association until the day before. Even the day before the ultimatum was going to expire, it was the Ministry of Labour that engaged our association. Unfortunately, even the minister was not there. So the key primary ministry was not also present, which meant that that meeting was a deadlock and there was nothing we could get out of that. But eventually when the strike started, they started engaging the association. And when they then gave some concessions on some of these key things and gave timelines, I think the leadership felt that there was need for us to review the situation and see how we can, we trust our people. People are counting that those deadlines every day. If you check social media, you probably see posts about countdown to those concessions and this, so that if nothing happens, then the leadership will have to step in again to see what we need to do to get the government to do what they need to do.
It always amazes me why we seem to be in a country, in a system where nothing really happens until people are held by the jugular. And I think at that point it becomes more complicated, it becomes more expensive, it becomes a wider conversation than it needs to be or that it needed to be. But I think some people may have knowledge of what some of these concessions actually are. I don't think we've really got to the point of what concessions did the government actually promise, or did they commit to say that, okay, by this time, by so time, these things will be certainly put in place. And is it fine? It's a leadership executive decision that was made, but wasn't there any sort of resistance from the members themselves to say it's not enough, we still want to stay on strike? Did you face any of that? Did you deal with that? But what was so convincing about what the government committed to, right, that made you guys call off the strike?
Well, we had a 9-point core demand that was placed before the government, and for the first one, some of them are really low-hanging fruits that we even felt that could have been sorted before the strike action even commenced. For example, the issue of gazetting the scheme of service. I mean, it's just something procedural that the government can do. It's just to get those who are supposed to print this thing. This has been approved since 2016. And to just get those people to print it and
is it that there's no ink in the printer?
I wouldn't. So that's why I said that some of them are really low-hanging fruit that the federal government. But thankfully, at that engagement, they made commitment that the office of the head of service has been communicated, and they would commence process to gazette that as soon as possible. Also, the issue of directorate and creating a department of nursing. There's one thing we call the IEP Award of 1981, which was awarded to the profession, which effectively pronounced the profession as a profession sui generis, because there was some contentions at that time. And it will interest you to know that some of the judgment that we're referring to, was essentially to reaffirm what was given in 1981. And in that award, these issues of directorate of nursing were mentioned. So that's why I said that we have really been patient. You can imagine something that was given in 1981, gazetted in 1983, and we're still talking about it in 2025. For a professional group that constitutes up to 60% of the workforce, essentially of that sector. And if you're going to create a department, there are criteria, but no professional group, fulfills that criteria more than nurses, because it says that you must have a substantial, cadre of forces within. And we are just simply the largest in any healthcare setting. Nurses are the largest professional health professional groups within that. So it should ordinarily be a no-brainer that you should create that department. It shouldn't be something. But again, in this one, they have said that they have written to the Accountant General of the Federation for proper interpretation of that judgment and implementation. And so some of the core issues around the professional allowances and things like that, a meeting will be held tomorrow to continue discussions around that. And we hope that, but there's also a 2 weeks a time bound that's been created to conclude discussions around this thing. Because, like I said, what we have seen is that you've seen high attrition going on for so many years, people leaving the country because, but the question is that what then has been the response of government? Those places where people are going to, it's because you go there, they'll promise you this sign-on bonus of $10,000, then they'll promise you housing for the first 3 or 6 months. People know that this set of people are in high demand, and you have to create incentives
to keep
to
them.
get them.
Yeah.
So, and that just tells you that those countries prioritize the health of their citizens, and they need to fill those vacant positions. Interestingly enough, we have close to, I think, about 5.9 million global shortage of nurses. Even the ICE, International Council of Nurses, we have about 13 million. So, and 89% of that exists in Africa and Southeast Asia. And if when you talk about Africa, you already know Nigeria is like 1/5 or 1/6 of that. So where you have the most amount of shortage is where people are also living the most. And that's also where the government is not even doing anything to see how to. I mean, thankfully enough, in Lagos State, we had did some struggles in the past in 2022, and we got a retention allowance payment to nurses here. Not so, but at least there's something that's been paid to it, which is not happening anywhere else. And you always ordinarily feel that should be something that the federal government should adopt. Exactly. That you need to pay something to keep this. If something is in global demand, look at what happened during COVID-19. The countries with the most money, with the most whatever, will take all the masks and everything. And those of you who do not have anything,
you are left to fend for yourself.
Exactly.
Yeah. So if I get you correctly, most of the demands that the nurses have made is not even about finance. It's mostly about structure. It's the nurses coming out saying that they're tired, they're stretched, they're stressed, they're overworked, and they are underpaid, and all they need is respect and structure so that they'll be able to do their jobs better. All right, well, we'll take another quick break now, but when we return, we'll turn our focus to an even deeper crisis, that's the mass migration of Nigerian nurses, because over 42,000 nurses have left the country in just 3 years. What's pushing our nurses away, and what's the government really doing to stop the brain drain? Are recent promises enough, or just another round of broken policy commitments? Oloruntoba Odumosu stays with us as we unpack this next episode. Don't go nowhere.
You are still watching Jasiri on News Central, and we have been discussing about the healthcare system, addressing the nurses' industrial action, the strike that happened, the suspension, and what happens afterwards. I think one of the problems that we have, one of the fundamental problems that we have is administrative. Yeah. Because just hearing you talk about some of the things that had been like a judgment from 1981 that you're still trying to push through now. And in my head, when you were saying that, I was thinking, but then what has the leadership of the association been doing all this time? Yes. Because the nurses, right? There's only so much that they can do, and that we're in a system where if you can't beat the system, you jump. So they're not the ones who are going to necessarily stand up for their own rights or for their own rights and privileges. So it's the associations, right? And why does it take so long for things to get pushed through? And why does it always have to come to this end, to this head rather? You were saying earlier before the break that 42,000 people have left in the past 3 years or so. So it's a serious problem, the whole migration. So leading into that, why does it take so long? Why does it seem like until we're held by the jugular, nothing happens? Because now we're dealing with the brain drain. How is the government mitigating that?
Yeah, thank you very much for those questions. I think the first thing is that for us as an association, we would always do our own responsibility and job. We would, in fact, like I said, and that's why the association had to go back to court in 2012 to reaffirm what it had already gotten before, to get another judgment from industrial court to reaffirm that judgment. And out of that judgment that we got again in 2012, only the scheme of service that was approved by the National Council of Establishment was gotten, but which had not now been gazetted. It's been approved since 2016, but has not been gazetted. So, but that's just to tell you that the association would always do its own bits. It took a long time of court cases, argument, and all that to even get to that point of getting that unified scheme of service. All those years, and now we have gotten to that point. We've gotten it. I work full-time with the association. I know these issues are discussed every time and their engagement with the government, their letters, their things that have been written. But when you don't get results until you have to, eventually go into industrial actions of this nature. Like I said, I mean, we are not people who are irresponsible. We don't just wake up and call strike action. Ultimatums were given. You can imagine that within that ultimatum, there was no engagement at all, not even a meeting. So, I mean, so that is not the fault of the association. That the association will always its own beat. We'll engage, we'll fight, we'll do this, we'll write letters. But if the response is not commensurate, it's going to make it look as if not much
is being done,
by the association. And it's really unfortunate that, like I said, even without the association pushing for certain things, I think that if the federal government itself looks at its own workforce survey and looks at the dynamics and you see people, it should prompt a reaction, a policy response that says, okay, what are we going to do to mitigate this level of attrition and all that? So it doesn't have to necessarily be that, nurses are busy, you have to do this work, you don't want to be distracted with every time you have to call people off duty to do struggle and all those things. So that I think the thing is really that the federal government and all the governments at all levels must just demonstrate commitment to the health of ordinary Nigerians. Okay. Who are the people who use this?
I think I'm thinking ahead of. When I hear you speak, I'm thinking ahead. I'm asking, just for clarity, if you can indulge us and take us through, because we hear nurses. Oh, nurses, now nurse, she's a nurse, but we don't really understand the gravity of what they face on a daily basis. Maybe the pressures at work, the pressures, just being a nurse. You're overwhelmed. We now know that nurses are overwhelmed in the country. If they are not jack buying, during the break you were saying nurses earn like 20K. There are some nurses that
those ones are not nurses.
I don't even want to go there. So can you take us through the life of nurses? What's the impact of the exodus of so many nurses? When nurses we always have this discussion that when doctors go on strike, it's the nurses that are on ground to, manage a lot of things. So
when nurses go on strike, what happens?
Exactly. When nurses go on strike,
the system shuts down.
So let's take a look. Can you share a specific example of a ward, a unit, something that was crippled by understaffing or the exodus of nurses? How does that look? Do you have an experience you can share with us? Just for let's fully understand the gravity of this.
For us as nurses, especially those who are on the wards, you are responsible for the patients all around the clock.
Yeah.
So in a situation where you are having understaffing issues or what have you, what it means is that the critical cares that you're supposed to give, that you are not able to, you have to manage time or say, and that's why you now see situations where relatives are, have to come in to do that because you don't have enough funds to do
a lot.
Those things. And through the training in university and all those, throughout the training, that certain things, those things are not just ordinary. There are rationales behind what you're doing. There are things like that. So, but now when you have to, families have to come in to do certain, you're in any way you're compromising the quality of care that the person will eventually receive. And of course, the life of the person. Exactly. So eventually, you have to.
I was going to say that
you're going to sit down to prioritize. Okay, I have to do this. I have to do this. And I just have to let go of the rest of it. Because ordinarily, by training, you want to do the total nursing care. You want to do everything that you're supposed to do for a patient.
Mr. Oloruntoba, because you are on the same trajectory, because we've had some alarming report that sometimes some nurses have to work with about 30 to 40 patients.
Yeah.
Is that something realistic? It's a bit hard to...
I know. As an association, we've had to deal with cases recently, and I mean, it just shows in the data. When you have people under pressure, then mistakes happen.
Of course.
That's if someone is supposed to care for 5, and the person is caring for 50, they're not machines. It means that something will break one day.
Yeah.
So, and unfortunately, it's the license of our people that will be at stake. The system will not take account of the fact that you have overburdened these people, and that is why you are experiencing some of these issues that we are seeing within the system. And that is reality. You see nurses nursing 40 patients, 30 patients, the only person on the ward, or just 2 people, just in between the two. and then maybe you have someone that just coming from theater and all.
Something will happen.
So something
bound to happen.
Definitely.
Is this also,
even machines, when you pressure it to the point, it will break.
Is this also where the quacks come in?
Yeah, you see, that's
yeah.
a whole different, because I think, unfortunately, these people are, of course, mostly women. So, and for nursing, while it is not a female profession, it is female dominated.
Yes.
And when it comes to this sort of quackery that is going on and naked exploitation of young girls, it is also a gendered crisis. So that you see people who, instead of employing professionals, you go and pick up a secondary school student and then you put them in your clinic facility and you say you're training them. When you know that, I mean, to become a nurse, is that you go to university and go for a fight. In fact,
it's a rigorous
as it is
training
now in Nigeria, there's no training for nurses that is less than 5 years. Because even when you go to the College of Nursing, which is now some reforms have happened that's made it an HND. The program is still non-terminal, and you have to spend 5 years. So, in an institution, so you then, sit down within your own small facility somewhere remote and say you are training people. So, I mean, and those are some of the people you see being paid 10,000, 15,000, just nakedly exploited for years like that. Exposed to all sort of health hazards that they don't even understand.
So how does that, I know that this is a little digression, but it's still a very important conversation. How do we mitigate that? How does the ministry, the ministry get involved? How is it being monitored?
Yeah, you see, essentially,
because it's people's lives we're talking about.
Because essentially the regulation issue still lies with the government. Because what it also means that unsuspecting Nigerians are being treated by people who do not have the competence to do what they're doing, or even have any training or license to work. So for them, there's nothing at stake. For a nurse, if you do anything, there are tribunals. You can be reported to the Nurse American Council, and tribunals will be set up to investigate what has happened, and your license can be withdrawn. But for someone who has not gone through any training, you can't even account for what they know. Because you train someone in your own hospital, another person trains them. You don't even know what.
There's no uniform.
There's no curriculum. There's nothing. Shit. So, but I mean, that just tells you that we're just, even these issues that we're dealing with are just a tip of the iceberg of the bigger issues within the health sector. And I would say that they're also a symptom of other fundamental issues of low budgetary allocation. You're really not going to get a superb healthcare system at the 2025 budget, 4.7% of our national budget. You're talking about 1.9 trillion, in which about 1.2 is already for salaries and all that. So
where is the extra for the development itself?
So the capital vote for health for this year is less than what we want to spend on even the airport thing. For the whole 74 federal institutions we have in the country, the capital vote for this year. So that if you have that kind of low budgetary allocation, that's against the 15% Abuja declaration that we always talk about. But even for us as a developing country and where we are, and the years of neglect that we have seen within the health sector, we should be talking about even more than what is recommended. For us to play catch up with what. So, and unlikely for us, one would think that, the government and our elite needs to be going from what we have experienced in COVID, that you can be locked down somewhere, and you're left to whatever is available there.
But just before Catherine comes in now, you talked. There was a question that Buki asked, about how all these challenges can be mitigated, and I talked about the government, being able to do that. But do you think the government has any plans at all? Are they going to be able to, because one of your demands is, that you're understaffed and you need more nurses. Will they be able to reverse brain drain? Will they be able to look into some of these challenges and make sure that, everything works well?
Please just hold that thought and ready your answer. Let's take a quick break. This is a last break as we hit the final stretch, the home stretch as we like to call it here on Jasiri. We'll be right back. All right, welcome back to Ajah. So this is the home stretch, and we have to give our guest, he's been gracious and he's been calm. The way you can't imagine the questions we've been bombarding him during the break. So before we go into our next question, now it's going to deal with the memorandum of understanding and policies with government and how to hold them accountable. But before the break, Dashan was asking a very intricate question that Buki first asked you. So all of us are very interested in what's going on with the nurses and the movement.
What's
and
the plan? Does the government have any
It's a given.
plan?
What we know here for a fact is that nurses go on strike. It's a problem. That's a given.
Well, I think we would really hope that the government has some sort of solid plan to keep people here, and because as part of the agreement, for example, they said that mini waiver to employ about 14,000 health workers, and about 60% of that will be nurses and things like that. We would love to see that happen. But what we also love to see is that you have to find a way to retain those who are there, because there's also, when one person leaves, it's not equal to you employing another person. Yeah. Because there's institutional knowledge, there are levels of skill. If someone who has spent 15 years within the system leaves, and you employ someone who just finished, they're not, one person, the person who has spent 15 years is probably equivalent to 3 people who are just coming in. So, and that if you keep at that level of attrition, you will definitely lose some institutional capacity after some time. Because those who are coming who don't have that level of skill that people who have been there for a long time would have. So that's why the government, we would hope that they have a plan to ensure that we can retain people for as long as possible, so that skill sets and what experience and knowledge has compounded over the years are not lost to the global north, who already have so much and are still extracting from our own area. Because you're working, you might see certain cases that you wouldn't see, that you maybe saw in your year 5, that you wouldn't see another one in another 5 years. But that experience will be important by the time you need to interview. But when many of the people who are seeing different things that can bring those knowledge are not there, it becomes a problem. So, and I think for us, our hope is really that we get, the government has huge plans to ameliorate these problems, to have long-term solutions to them, and not just in allowances. There's also working condition issues, equipment, investment in training, in improving the capacities of nurses and things like that, and also issues of quackery. Because I tell you that the quackery that we were just talking about before, if we shut out people who have no business within the health sector effectively through proper regulation, that would mean that more funds are available to employ those who are supposed to actually be within the sector. For example, one of the other foundations is the fact that we do, almost 70% of us do our healthcare expenditure out of pocket. That cannot work. You can't sustain the health system that way. So those are some of, the foundational issues that we just have to find a way to resolve.
I see the way the Nursing Association is trying to be as humane as possible. But would you not say that this humanity that you have is to the detriment of those that work within the association? Because they are bereft of everything. They are bereft of training, there's infrastructure, there's no development. The challenges are too many for you guys to be efficient enough. To be efficient, or you are not attacking the government abroad. I beg to differ. I have been abroad one time that they said nurses were striking. Oh my God. You should see the race that the governor of the state I was in used to address. They said, the nurses said they will go to other states. Some, they are traveling nurses. They are all kinds of, it was then I knew that nurses, there are so many types. I never even know that this kind of, but it seems that it's your docility that is making the government just do like, okay, nurses, maybe it's time for you to bring out your boxing gloves and really get into the arena.
Which I have some boxing gloves at home.
Yes, to engage them.
Let's put another layer on this conversation, because let's take a look at future action. If the government reneges or refuses to cooperate, governments, they can have brainwave and decide not to follow through with the MOU. What's the next move? Are we going to be looking at another warning strike, or this time you guys are going to go the whole 9 months? Exactly.
Yeah, thank you very much. I think like I said, we have always tried try to, at least within our own association, have some restraint. But what has happened in those 4 days has made it very clear. So I was out and with our team and we were monitoring. The whole system was shut down. So I think the government understands what is really at stake and the pressure got to them. And I will hope that they don't want us to have a repeat of that. But for us as an association, of course, we would sit down at the appropriate organ level to review what has happened with the things they have promised. And if nothing has been done, we're a union, we will use the instruments within us. And I would say that we have always, within our own ambit, fought. You know, within JOESU, the coalition, which the association was also part of, there were several strike actions in which some of these issues were also on the table. So, but I mean, for example, in Lagos, the retention allowance was also a fruit of struggle. We, in fact, went on a 1-day strike action. But thankfully, the government responded. We met with the governor, and he gave assent to almost everything that we demanded at that time in 2022, and which is what led to the retention allowance at Lagos State. But only Lagos State nurses enjoyed that.
Only Lagos State. Why isn't this a federal, a national thing? So, anyway, that's a much longer conversation. But Lolo, you have a question about the future.
Yes, I was going to say, let's end this graph. Because I think the Nurses Association are a very quiet, you know, very well-behaved association. So let's look forward, like in a utopian situation. Like in 5 years' time, let's fast forward, like all those time travel films. What would a fully reformed and respected nursing profession in Nigeria look like? What key reforms would you have expected to have taken place to make this vision real? Not just for nurses, but for thousands and millions of Nigerians who depend on them. Like everything is working well. Can you paint us a film so that Catherine and I can produce?
I will produce, Catherine will act, you will sell.
Kilode. So give us what you think an ideal situation. Imagine all these things you discussed are all meant. Paint a beautiful picture for us.
Yeah, I think the kind of future we hope for is where our members are working, are able to do the work that they need to do with the right staffing level. WHO recommends 1 to 4, 1 to 5. Now in Nigeria, we're talking about 1 to 1,160. So we want to see a situation where our members are able to, you know, work with the right equipment, work within the right environment. We want a situation where they're able to have access to, you know, decent housing, have good salaries that can make sure that they can cater for their own, for their families properly. I mean, this is what people already easily enjoy abroad. We want to see our people given the room to practice to the full extent of their training and education. As well as some of the challenges too, that nurses have this much capacity, but there are bureaucratic directives around what is frustrating when you're with your clients and you can't do certain interventions that you have the clinical skill set to do. So I think that we want to see a healthcare system that is properly funded. You don't want to see your patient in distress in terms of paying for what they have to turn people back because they can't. So those are some of the things that you would want to see.
I like the future too, my brother.
Honestly, you know, I also think that if the government wants to do something about this, you know, they need to treat the nurses with better care and not as if they are dispensable. Because believe me, they're not. And the nurses are leaving in droves. And once they all leave, what happens to the healthcare system that, you know, is in deep crisis as it is? Well, and that's where we wrap up today's conversation, but not to fight. You know, the suspension of the strike may bring temporary relief, but the deeper issues remain. Mass migration, policy gaps, broken promises, and a healthcare system stretched far too thin. What we've heard today is a call, and not just policymakers, but to every Nigerian to care, to question, and to act. Because when the people who care for us are unheard, we are all in trouble. We will definitely suffer. So I want to say thank you to you, Oloruntoba Odumosu, for standing in the gap and also for speaking to us in this. We appreciate you for your time. Thank you.
Nigerians were trying, that's all I can say.
It was clear to be